This work is a part of our ongoing project with Professor JSHHE and JSHHE. We have no conflict of interest to declare related to this presentation. Today's outline of this presentation, we briefly present our 4 parts: introduction, methods and participants, results and discussion, and then conclusion. Introduction. Globally, there are about 1.9 billion women of reproductive age. Every month, around 1.8 billion women are menstruate among them. However, about 500 million women still lack access to proper menstrual product and sanitation facilities. This global issue shows that the importance of improving access to both menstrual products and safe sanitation facilities, especially in low-resource cities. In Bangladesh, there are about 39 million women of reproductive age. However, only 30% of women have correct knowledge about menstruation before their first minute. Around 29 use sanitary pads, while almost 65% still use old clothes. Menstruation is still considered a shameful topic in many families. Previous studies showed that economic condition and family background strongly influence women's choice of menstrual products. We chose nursing students because they are future healthcare providers who can play a key role in promoting menstrual health awareness. Their own knowledge, attitude, and practice about menstruation reflect both personal experience and professional education. So our objective was to see how mothers' education and students' own education level influence their access to menstrual products and water sanitation and hygiene wash facilities. Participants and methods. The study was conducted among 7 nursing colleges in 4 regions in Bangladesh. We include both diploma and bachelor nursing students that are collected through 370 survey and 3 focus group discussions. Each group contains 7 participants. We analyzed the data using both quantitative and qualitative method. We used logistic regression to find associations and thematic analysis for qualitative data, and we also included direct quotes from students to understand their feelings and experience. Results and discussions. Menstrual hygiene product preferences. Most of them, about 61%, used single-use sanitary pad and 32% used old clothes. Students in the Bachelor of Science in Nursing program were much more likely to use sanitary pads with an adjusted odd ratio of 6.91, while diploma students also showed less use with an adjusted odd ratio of 2.96. During the focus group, one student said, "I always use sanitary pads." Another said, "If there is no pad, I often use clothes or tissue." In national data, only 29% of women use single-use pads, while 65% used old clothes. But in our study, more nursing students use pads, which is higher than the national average. This means that nursing education helps improve awareness and access to better menstrual products. So we can say that education level influence menstrual hygiene behavior among nursing students. Parental education of product selection. Students whose mothers had lower education or whose families had low income were more likely to use old clothes during menstruation. On the other hand, students with educated parents, especially fathers and mothers with high education, were more likely to use single-use pads. Many students said that their mother was the first person to tell them about menstruation. One girl said, "My mother first told me about it." Another said, "When it first happened, my mother helped me and explained it happened to all girls." This shows that menstrual education and guidance are very important for safe menstrual practices. Education, family influence, and economic condition all plays an important role. When these factors are poor, girls often follow unhygienic practices like using old clothes. Among all factors, parental education, especially the mother's education, was the most important influence on healthy menstrual behaviors. Challenges in water, sanitation, and hygiene access. We found that students from diploma programs and those whose mother had secondary education had higher odds of reporting water, sanitation, and hygiene access problems. Many students said, "Normally, we change in the washroom, or most of the time I change in the toilet." Some also mentioned, "There is a public toilet, but no water and soap." This means that even educated students still face poor facilities for changing and cleaning during menstruation. The situation is similar. Studies in India and Nigeria, the same economic background, where poor wash facilities also affected safe product use. Many students said there were no private place to change and no proper bins to throw used pads. These problems make it difficult for them to manage menstruation safely. We found that these issues were influenced by the types of nursing courses and by their maternal education. At the conclude, students with higher education, especially those in the Bachelor of Science in Nursing program, were more likely to use safe menstrual products and have better access to wash facilities because they know that how to manage properly compared to the diploma education. Similarly, students whose mother had secondary or higher education also showed better hygiene practices. It's because of the transformation of the education from mother to their children among the girls. So no students say that they can get information from their father or any male family members. Similarly, students, therefore, personal and maternal higher education is crucial for improving menstrual hygiene and health. For future research, we plan to follow menstrual health and hygiene intervention in the academic settings and conduct policy level analysis on how to improve menstrual health and hygiene. Thank you for your attention. If you need more information, you can contact me, and you have feel free to ask me any question or comment. Thank you all.
Thank you very much for your presentation. Now we would like to move on to the Q&A session. So does anyone have any comments or questions? Please.
I'm Yoshida from Hirosaki University in Aomori Prefecture. My question is, what is the main resource? What's the main purpose for them to get the information? How about the internet? Would you tell me about that?
Oh, thank you, Sensei, for your nice question. In Bangladesh, usually ministerial hygiene education not formally introduced before 2015 in the academic curriculum in high school. So before that, no students can get ministerial information from their schools. Only there is a historically cultural taboos that this is the women's topic. So every girls should get information from their parents, like only mother and their sister, if they have sister, if they have auntie, if they have grandmother. So every female person should have teach the ministerial education. And in the school setting, in the high school, there is a subject in gynecology and biology. That subject, if the male students there, so the teacher give them separate, so they teach them separate education. So the education is so important for the ministerial health and hygiene. As you show that the nursing students, they are the special educated women, and the diploma education, the curriculum is compared to lower than the bachelor education. So that's all, Sensei. Thank you.
How about the paper products, books?
Books.
Books.
Yes, there is no books in Bangladesh, but we have a national strategy for how to minister health and hygiene, but it's not for Ministry of Health, it's for the local government. So that's the far gap between the Ministry of Health and the local government, and of course our education is under the Ministry of Education. So quite there is a little bit gap. That's why we want to try next step to how to make the policymakers to combine the ministerial education.
Thank you.
Thank you, Sensei.
Does anyone have any comments, questions? Right, then I'd like to ask you a few questions. So about the first question, which is related to what he just asked you. So I believe he has asked me a very important question. So in terms of the access to internet, because as you know, nowadays SNS is becoming more and more popular. So it's easy to imagine that people can get some information from the SNS. So what could you tell us about that?
Yes, thank you, Sensei, for your interesting question. So internet access is not common in the rural area. Only urban, the city area, city girls and the city boys, they can access the internet properly and they have the mobile phone. But in the rural area in Bangladesh, it's not common for students to use mobile phone until they are in the high school. So parents don't give them the mobile phone like a smartphone, only give them the button phone that don't have any information. So nowadays it's gradually improved. So students can get, those who are living in city, so they can have a Wi-Fi access and they have the mobile phone. And mobile phone is not so cheap in Bangladesh, it's expensive, and also the internet. So that's why it's economic, very important. Thank you, Sensei.
Thank you very much. We have about 30 seconds. Would you like to receive the very short comments? Please.
What means the equipment situation is associated with the infection actually. Is it menstrual situation is associated with infection? My question.
Yes, thank you. Thank you, Sensei. Wonderful question. So we have asked the participants that they have
Answer
faces.
briefly,
Oh,
please.
yes, yes. They have faces urinary tract infection frequently, but we have not checked yet the association with the administration. So further we will do it. Thank you, Sensei.
Thank you.
Thank you very much, Zaman Sensei. Okay, now I'd like to move on to the next presenter.